Hello, viewers. Welcome to Ezra Wellness, where you learn proven ways to healthy living. This is your lady Salome. Today, I have with me a doctor, and we're going to be talking about, how to manage high blood glucose with fasting. Very interesting. Her name is Dr. Wilmot DeSouza. She's a board certified physician in family practice and lifestyle medicine. So, when the lifestyle come in here, I love that. It's amazing. She currently practices in Minneapolis in Minnesota, where she lives with her husband and two kids. She enjoys traveling, photography, and watching the cooking channel if she's not seeing patients. As a physician, her great joy is building relationship with patients and helping them to be better advocates for their own health. Her passion is to empower patients to live well and have healthier, happy days. And that is also our mission here at Ezra Wellness, to make sure that people don't even get sick to begin with. So when I met this wonderful woman, I was like, now we have this passion together. Let's make this video to educate our community. So Dr. Nana, welcome to Ezra Wellness.
Thank you so much for having me.
All righty, exciting. So today we're going to dig right in because I don't want to take much of your time. I know she's a mom too. So Dr. Nana, now the question goes for, what is considered high blood sugar? Because I know diabetes and prediabetes is big out there.
Yeah, so basically I consider high blood sugar anytime your body has kind of exceeded its normal kind of status of what it's needing, right? So you have a set point, and when you go over the set point, then that's high blood sugar. If you look, the American Diabetes Association has different kind of numbers for fasting should be, 80 to 130. And then you have like, after eating, you should be at this number. But high blood sugar is anytime you are basically just at above the threshold that you need to be at.
Yeah. So now, with that said, is there a difference? What would be the difference between diabetes and prediabetes?
So prediabetes, I look at it as a warning flag, So it's like, let's say we are playing soccer, you have the, yellow flag, and then you have red flag, like, red is like penalty coming, right? Yeah. But yellow is like, hey, my friend, you need to like be careful. If not, you're going to get a red flag. So that's what I figure out prediabetes and diabetes. Prediabetes is I'm giving you a yellow card because if you don't fix it, pretty soon your team is going to be short.
Wow, I love that. That is a beautiful analogy. So red card is your diabetes and yellow card is prediabetes B1.
Yeah.
Excellent. So then if we're looking at it like that, that means you're almost close, prediabetes. So now the question is, would people I know in your practice, as you see your patient with diabetes, are people with diabetes allowed to fast?
100% yes.
Okay.
But you have to, this is when it becomes art and science together rather than just like hardcore.
Yeah. So they are able to fast. And if it's 100% yes, what types of fasting would you say that somebody with diabetes will be able to engage in? Viewers, sure. I'm not saying you go ahead and go fasting because Dr. Wilmot is saying it, but we're letting you know that this also exists. So when you talk to your doctor about these conditions, you could bring these things into the conversation.
Yeah, I know a while back, Dr. Sam did a great job on giving your viewers the different, fasting methods and that kind of stuff. So if I have a patient that is, a diabetic and I'm going to consider fasting, first I need to understand who they are, what their quirks are, what are some hangups. Like I have to do some pre-work before I suggest the fasting, because once I get into fasting, we have like 16-8, 5-2, you have all these different regimens. But if I understand what the patient is like, then I can cater to their, specific needs rather than just a blanket go fast for however many days kind of thing. So it's kind of a case by case basis is how I usually go into fasting with my patients.
Oh, okay. So that means when somebody comes to see you in your practice, the fasting is going to based on that person's the individual. It's by your individuality.
Yeah. Because
I
have patients that work nights. I have patients that when you say fasting, their eyes are like, what did you just tell me?
Yeah.
And so I have to understand the goal ultimately is to make sure that the patient is successful. And so if I am designing something, I have to design it in a way that will make sure we achieve the most success, right? Yeah. So that means if this is a person who's scared about fasting and they've never scared before, well, I don't say go 16-8. I will say, how about no eating after 8 p.m.?
Okay.
No eating after 8 p.m. and don't go eat the very first, as soon as you open your eyes in the morning, don't go eat either. So we kind of start baby steps. Usually maybe say, let's try 12 hours, which means from 8 p.m. to 8 a.m., no food, right? And usually most people, you'll be sleeping anyway. Mm-hmm. So you can be able to do well on that.
Yeah. So then somebody is watching us and they're thinking, whoa, I've been told I have prediabetes. That means I have a yellow card. Now I'm looking at a way to incorporate fasting into my lifestyle. Would you say just fast, don't worry about anything else, or would you advise a way of going about it in a different way?
It's a multi-pronged approach, right? Yeah. So as when they give you the yellow card, you have to assess yourself and say, okay, how do I need to fix my life? And the reality is you have to really just look at everything. You look at your diet, you look at your exercise, you look at your sleep, you look at every single aspect that impacts you. Are you overworking? Are you, there's so many different areas. So once you can identify that, fasting is a great additional tool to incorporate because it helps your metabolism and helps you lose weight. But it's not certainly the end all be all, because you can fast and then go sit and eat like fufu and banku and,
everything,
like all these things and negate what you've done really quickly. But so you have to really think about what you're doing and what you really want to achieve.
Okay. So viewers, now when you're talking to your doctors, you realize that even if you have diabetes, you could fast. Talk to the doctor, see where you could bring it in. Now, Dr. Nana, what I always say is that people could start from no snacking, This is always a good place to start. If you stop snacking and you're able to eat just 3 meals a day, that alone, because if anytime that you are not eating, you are what? You're fasting.
Yes.
So that is what it is. And people get scared when you talk about fasting, but every night we all do fast because you are not eating whilst you're sleeping. So what we are saying is that just be comfortable to bring this fasting and don't be afraid of fasting into your lifestyle, because every religion, every kind of culture have some sort of fasting in there. So this is something that has lived with it for a very long period of time.
Yeah.
Okay. So Dr. Nana, what I would say is that when people want to reach out to you and say, maybe where could I find you? Where could people find you in case somebody is more interested in this fasting? I know now you are in Minneapolis, but possibly you find somebody close by for them.
So you can email me at Deswilwellness, which is DESWIL wellness@gmail.com.
Okay. And viewers, we're going to put that information underneath the video so that at least you see it, and contact her if you have any questions on this area. She'll be able to kind of guide you and just let you know the questions when you go to your doctor. You could ask him so that people you could join in. So Dr. Nana, as we bring our conversation to a close, what would you say will be your last words to people watching us with a yellow card and a red card?
Yeah, so my biggest thing is that fasting and diabetes is the best combination ever. Personal story, my father-in-law is a diabetic and his A1C was 9.5. He was not really doing well and, all his stuff, and he's Ghanaian. So obviously we eating all of our traditional foods. And he finally understood the concept of fasting. And just by incorporating fasting, which for him, he does 16 and 8, which means he doesn't eat anything till around noon. But by him doing that and cutting his carbohydrate content, he's been able to move his A1C from 9.5 to 5.5, and he's no longer on medicine.
Wow.
So I truly believe in it. It is something that is super powerful that you can incorporate so that you don't have to be on medication. Because as much as I'm a doctor and I love medicine, medications also have their own side effects. They're also expensive. And overall, diabetes is one of those things where I feel if I can show you, you have a red card or a yellow card and you can fix that thing, it is one of those things that you can, go into remission for, which means you don't have to be on medication for. So overall, if you're a diabetic, know there is hope for you.
Yeah.
Know that fasting is a tool that you can add, and know that it is possible, with a real life story about my father-in-law, to know that you can move from a chronic illness that can, affect you from the top of your head to the bottom of your feet.
Yeah.
And it can move you from that into a place of remission where you don't have to be on medication. So I'm happy to always answer any questions your viewers have.
All righty. That is beautifully said. Fasting, that means it's a death sentence. Please take charge. Do something about it. Get in touch with Dr. Nana here for any questions. If you're struggling on ways to eat, let Ezra Wellness also know, and we'll be glad to guide you to the choices of food that you should have. And I'm going to put all Dr. Nana's information underneath the video so that you could get in touch with her. Dr. Nana, thank you so much for your time, and thank you for coming to Ezra Wellness.
Thank you for having me. I'll see you guys soon.
Yeah. And viewers, hey, if you're new here, subscribe to this channel, share this video. Let's all grow healthy together. Until I see you in the next video, this is Ezra Wellness, where you'll learn proven ways to healthy living. Thank you for your time.